Okay, let's move on to the B letter. B refers to bone. Now let's look at the bone. In the knee MRI, we have the lower port of the femur, we have the upper port of the tibia and the fibula. First one, let's look at the cortex of the bone. Is you will figure out any kind of disruption of the cortex or lesions which expand through the cortex. It's very important sign to differentiate between a malignant or a benign lesion. Okay. Secondly, let's talk. In this case, you can see that the bone cortex in the lateral part of the lateral condyle of the femur is slightly, you know, disrupt. You can see a very small and tiny cracking uh, uh, shape in here, which represent for a kind of collisions, a kind of collisions lesion. Okay, that the first one is the cortex. Secondly, we evaluate or assessing the bone marrow of the knee. Normally, in case of a normal knee MR protocol, you will have the PD facets, PD and T1. The need in the bone marrow in the knee regions tend to transfer from the red bone marrows since the fetus period to yellow bone marrow or fat bone marrow in the adult period. Because of that, you will figure out that this kind of signal is hyper signal on T1 and non-facet sequences, and which is completely suppressed in the facet sequences, like in the PD facet in this case. If they anything wrong with the uh, signal of the bone marrow, for example, in this case, you can see several slightly focal hyposignal regions in the lateral epicondyle, in the uh, in the medullary part of the femur. It maybe the site of, of lesions. The most common abnormal what we frequently encounter in clinical practice is bone marrow edema, which represent for a situation where the bone marrow is infiltrated by the fluid due to the edema. It may be a site of trauma or or infection or um, neoplasia. The causes the variety in many situations. In this case, you can see that the most likely the most of the lateral epicondyle and lateral side or lateral aspects of the tibia that uh, irregularly hyperintense in the PD facet sequences, which is hypo on T1 that represent for a side bone marrow edema. And beyond that, you can see that there's a small focal, very hypo signal or you know dark signals in the uh, in the T1, which also dark on T2. It's represent for calcification or increase the bone densities in the regions. In this case, it's a side of the increase of the bone densities due to compression fracture, due to a compression fractures. Um, because we are dealing with a patient who has knee trauma previously. Um, uh, one uh, One of the other thing that I have to mention, which is whenever you are analyzing the bone marrow, is the one of the one of usual context that you will encounter many times, so many times in your career, which is kissing bone lesion. You see, in this case, you can see that the bone marrow edema present in both side of lower port of the femur and upper port of the tibia. And this kind of bone marrow edema is not spontaneously distributed throughout. It has its own. They have this own epicenter in here, which can be clearly seen in the side T1. The epicenter of the lower femur region present in the middle part of the lateral epicondyle of the femur, while the epicenter lesions of the tibia present mostly at the posterior. Because of that, we will, somehow can predict the mechanism of the injury here. Um, because the two we the at the very first time, whenever you see an image like this, you have to think that maybe this point and this point may be suffered from co- a collision lesions. This point is collision with this point due to a kind of lesion um, or dislocation. And because you can see here, it's clearly that this point cannot, uh, you know, randomly collision to this point if there's no dislocation or translation. In this case, of course, uh, beside the one slide FCL findings and the protrusions of the posterior aspect of the tibia, more than 7 mm compared with the posterior aspect of the tibia. It suggests the assigned anterior tibial translation, which means that the tibia has been shifted anteriorly and the posterior port of the tibia may be collisioned with this middle part of the femur, create the kissing bone lesions. This as I said earlier, this side is a very suggestive site of anterior tibial translation. Sometimes, if the sometimes if the sometimes if the collision is too strong, it creates a hole or a notch in the medial collateral regions due to excessive compression, compressing lesions, like this case, which you can also see it in the X-ray filmed at a deep femoral notch in the lateral epicondyle of the femur.